We are back here on Girl Talk. We are very honored to be with Dr. Eric Gwynn. Thank you for joining us.
Thanks for having me.
It is a treat today to have you on because, again, talking with women, about women, we often talk about women's health. Very rarely do we get the opportunity to talk about men's health. And as women, and I think wives and mothers, I think we all share the same question, and that is, are men good stewards of their own health? Is it oftentimes the woman who initiates the pushing and prodding of the doctor's visits?
Well, you're setting me up, but,
but yeah, we did.
The truth is, it is that way. You know, women tend to take care of their health a little better than we guys. We would like to, I think, ignore things many times until our wives or significant others bring us in for treatment. Now, that's not true of all men, but I think overall it's true. It's the masculine side of, I can get through this, nothing's wrong with me.
Okay. As men get older, what are some of the issues that they have specifically that may need to be addressed or can prophylactically be treated?
Well, I think prostate enlargement is very common, and that can affect a man's sexual health, urinary symptoms, getting up a lot at night, being well rested, as well as symptoms of hypogonadism or a low testosterone level. So much like in women who have menopause, this is kind of like a male menopause, whereas testosterone levels will fall. They'll have decreased energy, decreased libido, erectile dysfunction, loss of muscle mass, increased weight gain. It's not always due to a low testosterone, but in some men it can be. So much like women who are postmenopausal with possible hormonal imbalances, the man can have the same.
So at what age do you recommend a screening start taking place? And is that annual? Screening
for
the prostate?
For a PSA, screening PSA usually starts at age 50, unless you have a family history. There are some other things that factor into that. A positive family history, African American origin, you want to get tested in your 40s as a baseline, but generally at age 50. Now, as far as testosterone, we were just talking about, we don't generally screen for that unless there's a reason. If you have some of those symptoms, then we'll go ahead and do a screening test.
What do men usually come to the urologist for? Is it for, again, kind of an overall wellness check?
Well, it's a multitude of reasons. Urology and urologic surgery is kind of it's one of those interesting specialties where we do so much. There's a wide variety, men, women, all age groups.
Exactly. We were just talking in the break about incontinence and things like that, and how to prevent it, and how common it really is, and to try to kind of take the embarrassment out of it. It is what it is.
It is. Obviously incontinence is higher in women, but men have it as well due to prostate enlargement or history of prostate surgery. But
can I ask you a basic question? The prostate, what is it?
That's a good question. What is the prostate? Do you need it? Prostate is an organ that's primarily there for sexual function. So it provides a source of sugar and the volume for the ejaculate. So primarily it's there as a source to help the sperm survive to be able to fertilize an egg. But other than that, you can live without your prostate. And in fact, you can still have sexual function, ejaculation without a prostate. There's just no fluid.
And so it seems to be a vulnerable organ, though.
Vulnerable to?
Disease?
I think that's probably pretty fair. Prostate cancer, I believe, last check, was the second most common malignancy in men. Now, it doesn't always kill you. In fact, you can live with prostate cancer, many men, for a long time. We can observe it. But it's vulnerable to cancer, enlargement, and that's one thing women don't have to worry about is prostate issues, so they're check one off for women.
Are there certain lifestyle factors that contribute to maybe those diseases?
And interestingly enough, I get asked this question all the time. It's the same thing that leads to other health issues: obesity,
smoking,
high-fat diet, smoking. All of these risk factors.
All the things that are bad for you.
That's right. They can lead to prostate enlargement, risk of cancers, and you can't beat the genetic history. Someone who had a brother, father, grandfather with prostate cancer has a much higher incidence of developing the disease themselves. But yeah, healthy lifestyle, exercise, all of the good things, eat more fish, less red meat, are helpful.
And
One
we've
quick,
got,
go ahead.
Go ahead. I was going to say we've got new treatment options here at Coastal
Yes.
Carolina Hospital that you can just tell us about
Oh, you're
briefly.
so good. She's such a marketer.
We do. So at Coastal Carolina, as far as treatments for men, we have some newer technology. One of which it's very few in the country, called the Artemis prostate biopsy device. So therefore, men with elevated PSAs and suspicion of prostate cancer, we can now do what we call semi-robotic targeted MRI fusion biopsy, which is where we
Okay.
take an MRI, localize an area of abnormality, and biopsy it within millimeters to get an accurate result. Whereas we used to not have the technology to do it in our office, kind of in a blind fashion. We also have robotic technology here now, not just for urologic surgery, prostate removal, kidneys, but also for women to address vaginal prolapse. We can do that robotically now.
It's pretty amazing the caliber and quality of physicians we have here at Coastal Carolina. We're going to take a break on Girl Talk. Stay with us. There is more to come.